Hi, today is February 1st, 2013. This is Nichole. Hi, Nichole.
Hi.
Nichole entered the office late August of 2012. Nichole, would you like to just share with us why you came to the office and your journey, your health journey?
Definitely, yeah. It had a long history of digestive issues, and I hadn't been able to really pinpoint through traditional medicine, what those issues specifically were and what the best way to treat them were.
What was your primary symptoms, can I ask?
Yeah, absolutely. I primarily had diarrhea very frequently, probably 2 to 6 times a week, I would say, depending on the week. Some weeks were worse than others, but it was something that I just knew wasn't quite normal. But again, all I had really ever had as a treatment option before was, over-the-counter medications.
And how long were you experiencing those symptoms prior to coming to the office?
Yeah, for 5 years, I was experiencing those 2 to 6 times a week, having those severe symptoms, the sort where, especially if I ate out, but if I ate something that now I know was one of my allergies, immediately within half an hour to an hour after the meal, just having severe urgency, running to the restroom, and trying to and then that would continue usually for a couple days after those reactions.
How did you decide to come here and try something different?
Yeah, I heard about Dr. Sibley through a friend of a friend who had been helped with him, and I called and did a consultation with him over the phone just to see if it was something he could help me with, and I told him my history and what I had experienced, and it was the first time that a doctor told me that he understood what those symptoms were, that they were signifying could be a number of different things, and that he was willing to help me go down that road to figure that out.
And what have you discovered about yourself, and could you just explain your journey since treatment started?
Yeah, since treatment started, we did the array testing, and we discovered that I am gluten sensitive. I also have a number of cross-reactive foods, so I have eliminated all of those completely from my diet. We also discovered that I do have a parasitic infection that I'm still currently treating, but it's February now, and I really started to see change after about 2 to 2.5 months of being strict, being off those foods, and really taking Dr. Joe's advice to try to make a lot of the improvements that were needed in my life. And I actually am feeling probably, I would say 80% better for sure at this point. I mean, I definitely see improvements that I didn't think were possible after the long history of the issues.
So what, out of curiosity, what's the biggest thing you've discovered in the context of your treatment that has helped you the most?
Definitely the food allergies. I think long term, I've realized just it's important to understand, if you have an intolerance, you need to be able to avoid that food, so that long term, not only to eliminate the immediate symptoms, but long term health is also greatly affected by eliminating those foods.
That's awesome. I'm proud of the hard work. Can I ask you one other question?
Sure.
How difficult was starting the program? If you had to rate the degree of difficulty embarking on your journey, coming from a medical model, how difficult was it to really implement the changes that I asked you to make?
Yeah, I mean, it definitely it was difficult for sure. It's something that I would encourage people, that it seems really overwhelming at first that you have to eliminate these foods and you feel like, oh, there's nothing out there for me to eat, but that's not true. Even just a few months in, I feel like I've really figured out what works for me and gotten in a routine of incorporating healthy foods that really help my overall nutrition, and there's still plenty out there. It's just a matter of understanding what's good for you.
So you don't feel undernourished?
No.
And there are options.
There are options. You might have to do a little research. You might have to call companies, especially if you have, corn was one of my allergies, and I found that's actually been more difficult than the gluten and the dairy to eliminate, but there are many products out there and many people who are willing to help.
That's excellent. Do I have your permission, Nichole, to share this information in your story with doctors, students, and patients anywhere?
Yes, you do.
Any restrictions on that?
No.
Thank you so much.
Thank you.